Now come to the sixth SEQs. Name various layers forming the wall of esophagus. What type of epithelium lines the lumen of this organ? And the second part of the question is name different types of glands found in the esophagus. Now, there are three parts of this question. Name various layers forming the wall of the esophagus. Second, what types of epithelium lines the lumen of this organ. Third, name different types of glands found in the esophagus. Now, topic specification is from special histology. Now, the key answer, the first, name various layer forming the wall of the esophagus is a mucosa, matlab from inside. There is a mucosa, then submucosa, then muscularis externa, and the outermost is the adventitia or serosa. Now come to the second part of the question. What type of epithelium line the lumen of this organ? Epithelium lining the lumen of the esophagus is the stratified, squamous, non-keratinized epithelium. Now come to the third part of the question is name different types of glands found in the esophagus. There are two types of gland. Number one is superficial, second is the deep. And superficial gland also known as cardiac glands present in the mucosa, and the deep are the submucosal esophageal gland present in the submucosa. Now come to the seventh number question. Now here we clear the layer of the esophagus. Inside the lumen of esophagus, the first layer which toward the lumen is the mucosa. Then after mucosa is the submucosa, then muscularis externa, and then the outer layer from inside to outside is the adventitia or serosa. Now complete the question number SEQs number 7. Give the boundaries of sub-occipital triangle. Name its content. Now topic specification from gross anatomy of head and neck. Now the key answer of the first part of the question, give the boundaries of sub-occipital triangle, is the boundaries of sub-occipital triangle. First is the superior medially, superior and medial toward the mid of the our face, mean mid plane. There is the boundaries of the sub-occipital triangle. First is the superior medially spanned by rectus capitis posterior major muscle, and superior laterally, mean away from midline, is the obliquus capitis superior muscle, and inferiorly the obliquus capitis inferior muscle. These form the boundaries of sub-occipital triangle. Now come to the contents of the second part. Name its content. Content of the sub-occipital triangle is number one, dorsal ramus of first cervical nerve, and second is the vertebral artery, third is the posterior arch of atlas, and fourth is the sub-occipital plexus of veins. Now come to the question number 8. What structure passes through the jugular foramen? Name the tributaries of the interjugular vein, mean branches of the interjugular vein, tributaries. Now topic specification from gross anatomy of head and neck. Now the key answer is structures passing through the jugular foramen are 5 in number. Number one is the glossopharyngeal nerve, second is the vagus nerve, third is the accessory nerve, and fourth is the inferior petrosal sinus, and fifth is the terminal part of the sigmoid sinus, which continue as the interjugular vein. Now come to the second part. Name the tributaries of interjugular vein. There are 6 tributaries. Number one is the inferior petrosal sinus, second is the pharyngeal plexus of vein, third is the facial vein, fourth is lingual vein, and fifth is the superior thyroid vein, and sixth is the middle thyroid vein. Now come to the ninth question. Question number 9. Name different layer of the deep cervical fascia. What are the relation of carotid sheath? Now topic specification is from gross anatomy of head and neck. The key answer of the first part, name different layer of deep cervical fascia, is the layer of the deep cervical fascia are investing layer, prevertebral fascia, and pretracheal fascia. These are the layer of the deep cervical fascia. Now come to the What are the relation of carotid sheath relation with other structure? Anterior-medially carotid sheath relation anterior-medially with the thyroid gland investing in the pretracheal fascia, and anterior-laterally with the sternocleidomastoid muscle enveloped in the investing layer, and posteriorly with the prevertebral muscle covered by prevertebral fascia, which is the cervical sympathetic chain. Now come to the SEQs number 10. Name different surfaces of the parotid gland. What are the relation of the anterior medial surface? We name different surfaces of the parotid gland. What are the relations of anterior medial surface? Mean interior and medial surface relation. Now topic specification from gross anatomy of head and neck. The key answer is the what are the surfaces of parotid gland are the anterior medial surface, posterior medial surface and the lateral surface. Now come to the relation of anterior medial surface is the from lateral to medial facial nerve, external carotid artery, maxillary artery and maxillary vein, transverse facial artery, superficial temporal artery and vein, neck of the mandible and the parotid gland. Now come to the question number 11. Name the ligaments of the temporomandibular joint. What muscle are responsible for its elevation? Now the topic specification topic is from gross anatomy of head and neck, and the key answer of the first part, name the ligaments of the temporomandibular joint, is the first is the lateral ligament, which is part of the capsule, actually the condensation of the capsule. Second is the spinomandibular ligament, which originate from spine of sphenoid bone and enter into the mandible. And third is the stylomandibular ligament, which originate from styloid process of temporal bone and enter into the mandible. Now come to the second part of the question. What muscle are responsible for its elevation? There is a masseter muscle, middle pterygoid and temporalis, because the lateral pterygoid is responsible for protraction of mandible, and muscle responsible for elevation of the joint is the masseter muscle, middle pterygoid and temporalis. Now come to the question number 12. Briefly describe the arterial supply and lymphatic drainage of thyroid gland. Now topic specification from gross anatomy of head and neck. Now the key answer of the first part, briefly describe the arterial supply and lymphatic drainage of the thyroid gland. First, arterial supply of the thyroid gland is from superior thyroid artery, which supply the superior region, superior and posterior, then inferior thyroid artery, which inferior and posterior, and then is the thyroid imma artery, which mainly supply to the mainly the third lobe or the interior middle part is the thyroid artery. Now come to the lymphatic drainage of the thyroid gland. Second part of the question is lymphatics from the superior pole pass to anterior superior group of deep cervical nodes, and lymphatics from the inferior pole pass to the posterior inferior group of deep cervical nodes, and a few lymphatic also go to the pretracheal nodes. Now come to the question number 13. How ansa cervicalis is formed? Name the muscle supplied by their nerve loop. The nerve loop of the ansa cervicalis supply to which muscle? Now come to the topic specification from gross anatomy of head and neck, and the key answer of the first part, how ansa cervicalis is formed. Formation of the ansa cervicalis, superior root contributed by the interior primary ramus of C1 spinal nerve, and inferior superior root contributed by interior primary ramus of C1 spinal nerve, and inferior root contributed by the anterior primary rami of the C2 and C3 spinal nerve. Now come to the muscle supplied by this loop is the steroid, sterothyroid and omohyoid muscle. Sternohyoid actually, sternohyoid, omohyoid and sternothyroid. Now come to the question number 14. Give the boundaries and content of the interpeduncular fossa of the brain. Now, the key answer of this question is the boundaries of the interpeduncular fossa interiorly by optic chiasma and optic tract, and posteriorly by cura cerebri and pons. And content of the interpeduncular fossa are four in number. Number one, oculomotor nerve. Second is the posterior perforated substance, and third is the mammillary bodies, and fourth is the tuber cinereum and infundibulum. Now come to the final question. Name the part of the brainstem what cranial nerves are attached to the middle part of the brainstem. Now topic specification from brain and spinal cord, and the key is the first part of the brain. Name the different parts of the brainstem. Parts of the brainstem are three number: midbrain, pons, and medulla oblongata. And second part, nerve attached to the middle part. Nerves attached to the middle part mean pons the middle part are four in number: trigeminal nerve, abducent nerve, facial nerve, and the vestibulocochlear nerve. Now these are the 15 important Seqs with explanatory answer of anatomy, which is important for MBBS and BDS both student. Now in the next videos we will discuss about the MCQs with explanation of head and neck anatomy, like head and neck, embryo, histo, neuroanatomy, general anatomy. Now if you like this video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.